So the other way to think about these things, which I've already touched on, is if you think about your personality disorder as helping to keep your personality, helping to keep you on an even keel. And therefore if you have a personality disorder, you find that you can't regulate your own mind. Your mind becomes disorganized. And some people have argued that we could think of there are maybe two different kinds of personality dysfunction. There might be a childhood onset one, which is associated with genetic vulnerability and high levels of environmental risk. But there also may be an adult onset one, which is milder, which is triggered by environmental factors, which might even be influenced by things like diet, certainly influenced by things like relationships with other people, also affected by trauma. So, for example, trauma-related personality disorder, adult onset, is in the diagnostic books.